Hello everyone, welcome to our presentation. I'm excited to have you here today. This is episode 19, and we're going to explore some interesting topics together. On this first slide, you see the title, and it's our starting point. Over the next few minutes, we'll cover key insights and ideas related to this episode. So let's get started and dive into what's coming up. Let's consider the question here. Smoking cessation is a critical strategy for patients with Buerger's disease. As nurses, we understand that quitting smoking can significantly improve outcomes and prevent disease progression. Now, Nurse Jasmine anticipates that this male client may go home with a prescription for a specific medication. Among the options, paracetamol, ibuprofen, nitroglycerin, or nicotine, what do you think is most appropriate? Well, since smoking is the root cause of Buerger's disease, the goal is to help the patient stop smoking. Therefore, a medication like nicotine, specifically Nicotrol, can be used as a nicotine replacement therapy to aid in quitting. This approach can reduce withdrawal symptoms and make the process of stopping smoking more manageable. So, in this case, the most suitable medication Nurse Jasmine would expect to prescribe is nicotine or Nicotrol. It's a vital part of managing Buerger's disease effectively by addressing the primary cause, smoking. Let's talk about nicotine, specifically the product Nicotrol. Nicotine is a key factor to consider because it's the primary addictive substance found in tobacco. Nicotrol is a form of nicotine replacement therapy designed to help people quit smoking by reducing withdrawal symptoms and cravings. When we look at Nicotrol, we're seeing an example of how medical treatments can support tobacco cessation efforts. It's important to understand that while Nicotrol can be effective, it should be used as part of a comprehensive quitting plan, ideally under medical supervision. This connects to our overall theme of understanding different tools and strategies to combat tobacco addiction and promote healthier choices. Buerger's disease, also known as thromboangiitis obliterans, is very closely linked to tobacco use. In fact, smoking is one of the main risk factors that can trigger or worsen this condition. That's why complete smoking cessation is absolutely the most critical step in managing the disease. By quitting smoking, we can significantly reduce the risk of disease progression and help improve the patient's overall outlook. Now, to support patients in quitting, nicotine replacement therapy, or NRT, can be really helpful. For example, nicotine in the form of Nicotrol can be prescribed to lessen withdrawal symptoms. This makes the process of quitting more manageable and increases the chances of success. Ultimately, addressing tobacco use is a key part of the overall treatment plan for Buerger's disease, and it connects directly to the goal of preventing further vascular damage and improving patient outcomes. Let's take a moment to look at why the other options are not suitable for smoking cessation. First, we have paracetamol, which is primarily used for pain relief. It's effective at reducing pain, but it doesn't do anything to help someone stop smoking. It simply doesn't target the addiction or the behavioral aspects involved in quitting. Next, there's ibuprofen. This is an NSAID, which means it's good for treating pain and inflammation. But again, it has no role in helping a person to stop smoking. It's just not designed for that purpose. Finally, nitroglycerin is used mainly for vasodilation and managing angina. It helps improve blood flow and reduce chest pain, but it doesn't have any effect on smoking habits or the addiction itself. So, when we consider smoking cessation, these medications are not relevant because they don't address the core issue, the addiction and behavioral change needed to quit smoking. That's why the focus should be on options that actively support cessation efforts.